Is that good?
We didn't gain much.
It's here. There it is. That it?
Yeah, I think we're fine. Pushing buttons. So, oh, we won't go there. Okay, on the air.
On the air. Here we go. Thank you, Mr. Ryan. We're going to get him in front of that camera one of these days.
Right. We're going to trick him.
We're going to have to trick him. Yeah,
somehow.
For sure. Well, hey, Keith and I are always looking for conversations to have on these podcasts.
Mm-hmm.
And I called him a couple of days ago and I said, Keith, I got all of a sudden a surge of people coming to me with vertigo.
Mm-hmm.
So they say it's vertigo. I'm learning that it may be dizziness caused by other things.
Oh, yeah, there's several causes. Maybe.
But everybody calls it vertigo, so we're going to start there. And so hang on. We're going to get going on this in just a minute. We got a kind of a session in the chamber just now. We talked about a lot of things, and so I'm really excited about what we're going to be doing. But I'm Paul with Hyperbaric Plus, and we're at 122nd and May in Oklahoma City, and we love having an audience in here. We got a place you can come and listen to this and ask questions, so I always invite everybody to come do that. And this is Keith with Prevail Over Cancer. He has become a great friend and helps a lot of my clients, and so we enjoy doing this weekly. And Keith, I'll let you do a
disclaimer.
I'd like to get the disclaimer out of the way just to say we did one.
Before we forget. So this information we're presenting is for educational purposes. We are not your doctor, and so the information means you learn from it. Take that information and talk to your clinician, your doctor, and make smart choices. So when we talk about supplements, supplements are not approved for diagnosis, treatment, prevention, or curing any disease. Doesn't mean that they don't help with problems. It's just not that they're not approved by the FDA and other maybe international health organizations. But so that's kind of the disclaimer, for this. But this is education. So we're not your doctor. We're not telling you to do these things. And we're talking about a lot of symptoms. And so these symptoms about ears, we're talking about, we're not diagnosing what your problem is either. We're talking about things happening inside your ears, which actually are your brain. Okay, so your ears and your eyes are part of the brain. So if there's problems with your retina, the back of your eye, and your inner ear going on, that's part of your brain. Very serious, and we need to pay attention to those symptoms and address that. So
we call the deviations in our eyesight and in our ears could be canaries in the coal mine, giving you clues of something that's a little deper.
Exactly. Yeah. So let me tell you a story. So this is a fictional story, but I've seen these kind of things happen. So, and I'll use a man, as an example of this. Because why is that? Because usually guys ignore things. Okay. But a person has all of a sudden some dizziness or ringing in the ears, and actually pretty significant. And then it kind of went away, and they didn't talk to anybody about it. And then 3 days later, they had a stroke because there's actually a blood vessel going up into the inner ear, and just one blood vessel. So there's not a redundant multiple blood vessels supplying the ear. There's one blood vessel going up in here, branching off into a very dense capillary bed, and these are little tiny blood vessels that the size of that is like one red blood cell can barely squeeze through. So these issues with the ears that we're going to be talking about, most of them have to do with circulation. If we have plaque buildup, atherosclerosis buildup inside that tiny little blood vessel where that red blood cell gets through, if that red blood cell can't get through there anymore and get stuck, now all those cells along the rest of that blood vessel start dying out. That's related to similar things to neuropathy, especially in the feet. The feet, a long ways from the heart. So, that numbness, coolness of the feet, those are some of those canaries, in the coal mine that have a tendency to die first before the humans are affected by chemicals. It's
called a fair warning.
A fair warning, that's right.
Coming at you.
So therefore, we have to pay attention. Now, yes, it is part of aging, but we sure don't want to have accelerated morbidity problems, with that aging. And even we want to delay accelerated aging. So I don't like the term anti-aging. We're all aging no matter what we do, but we can have healthier aging type tactics. So, so pay attention to these, and if you're starting to have problems with hearing loss, especially like one ear, if you have hearing loss in one ear, that may be a sign of poor circulation going up to that ear. Tinnitus or tinnitus, where the ringing of the ears, that's a compensation where the body's trying to improve the hearing, but it's doing it the wrong way. And then dizziness, lightheadedness, several different type of vertigo. It would be one general term on that. These are all signs of circulation issues, probably, in the ear. Mm-hmm. Now, nutrients can also be an issue. So nutrients, for example, myself, if I take a vitamin B12 sublingual, under the tongue supplement 2 or 3 days a week, I have almost no tinnitus. So I have done some things that allowed some damage to my ears, not wearing ear protection with loud sounds, wearing in-ear monitors in bands, and playing instruments, and so cranking up that sound too loud. So I actually have damaged my ears, but the tinnitus for me is a B12. But that only helps about 1/4 of the people I've discovered. Maybe a little more than that, but 1/4. But actually, it's something you'll know within a week or two. So, so when we talk about these things, I also want to stress: talk to a clinician and get more tests. We'll go through that a little bit more. And by the way, handout. I'm going to be looking at this handout. It's pretty lengthy. And I suggested we may be going 2 weeks on this.
Keith already gave us warning.
And some of this actually is a lot of references, for this. And so I can't remember the last page, 76 references, okay? Because we're talking about a lot of health items, and social media likes to make sure that what I'm talking about, what we talk about, is verified and not misleading people. So that's why I have 76 references with links. So you can go to...
I encourage you, if you know somebody that's because everybody I've talked to, in fact, I've got somebody in here today that said my sister and somebody else in her immediate circle of influence is dealing with what we're talking about today. They're dealing with vertigo, and that we just call it vertigo because we're dizzy. I mean, right. I hear a lot of people say vertigo, and if you extrapolate those symptoms, there's a lot of other things going on. It may not be vertigo. So anyway, if you know somebody that's dealing with this, send them a link to the show. Tell them we're going to be doing this again next week. We would love to get feedback, because there are people that are having success dealing with this, and we'd love to have some personal stories of, hey, I did everything, and then all of a sudden I did this, and it worked. We'd like to share those stories. Everybody's looking for hope.
That's right. Yeah, I'm glad you mentioned that, because everybody is different. That's why you need to seek a clinician, and don't take with one item and run with it and ignore what's going on. So, but we're going to have a Q&A period in about 30 minutes. So don't wait until 30 minutes to submit your questions, okay? Because in 30 minutes, Ryan's going to print off those questions, and we're going to trick him to come on camera and hand us that sheet. And then, but we'll get that sheet and we'll answer those questions in about 30 minutes. So submit your questions on the social media channel. Ryan's monitoring both Hyperbaric.plus and Prevail Over Cancer channels, and he's going to compile those into a sheet. But submit those questions, and if you have had success with this, tell us and share that information. We want to share that with people. We want to share this information. Matter of fact, we only have so much time, so we're not going to be able to cover everything. Once again, we'll probably go into more things next week. So submit your information, submit your questions, submit your stories about how something has helped with your hearing balance, issue type of thing. So now there can be some things that are not directly related to it. So, for example, if you stand up quickly and you feel dizzy or lightheaded, it might be an inner ear thing. It could also be low adrenal gland function. The adrenal glands make chemicals that increase your blood pressure and your heart rate. And if the adrenal glands are not making that epinephrine, also known as adrenaline, then we can get dizziness. So once again, there's, you need somebody to work with somebody. I want to stress that it's important to work with somebody. If you try to figure it out yourself, it may take a long time.
And it may not have the right outcome.
It may not. And so, but seek some help.
Yep.
Somebody that has some experience as part of your program, okay? And so, yes, you're important, you're smart, but, seek some help, somebody that's been through this type of stuff before and helps people with this. So we have that little story about the 3-day warning, that fictional person, but that really happens. It is a significant risk factor. So actually, in one study, they found that 5 of 16 patients that suffered a stroke, feeding the inner ear actually had symptoms definitely before it happened. So, so we got to pay attention to that 3-day warning, or any kind of warning, okay, not just 3 days. That's that story that I was making up. So the ear is an extension of the brain. Those nerves go into the brain and help with that, the brain to interpret those signals. So if we're having problems in the ear, there's also a risk factor for more brain problems. So there's actually studies showing that people that have hearing loss have a much greater likelihood of having memory problems and dementia and brain function problems. And they're just not processing things right. And that accelerates further dementia and processing problems. And it's a bad loop that a person can get into. And as a matter of fact, it's kind of interesting. Studies show that people that start wearing a hearing aid their brain function starts getting better, and they have a reduced risk of dementias. So by correcting that problem, that allows the rest of the brain to function properly. So our whole body is all interconnected. So it's important to help support the ears, and we'll continue to concentrate on that. So let's see. Even one loud event, we have, you've got a lot of first responders and military people that come in with some problems. But one loud explosion, even one loud gunshot, is enough to damage the ear.
So how about all those concerts I went to as a kid? There's another deal.
Well, as a matter of fact, I thought that reminds me. Back in the 70s, when rock was really going good, I couldn't play the music loud enough in my bedroom because my parents would be upset. So what did I do? Earphones, blasting.
And if you do earphone, and we talked about this, I hope I'm not jumping around, I didn't review this yet, but if you're using earphones, to where you can hear music over loud noise, whether you're mowing, whatever you're doing, but you want to hear that music, so you put headphones on or today iPods, I suggest that you turn everything on, you put them at the level that it takes for you to hear, and then you turn everything off. And see how loud it actually is, because you could be, I was damaging my ears trying to hear over the ambient noise. And it's so important that you get a baseline. You understand that, hey, this is what I'm trying to overcome. You may be damaging your ears trying to protect them because you're trying to listen to music during an ambient noise event.
And I'm guilty of that myself. And so I'm out mowing. I've got 2 acres around the house, 3 acres of horse pasture, and whether I'm driving the tractor or the lawnmower or using the weed eater. So matter of fact, a weed eater is like an 8-hour project, okay? I don't want to waste that time, so what will I do? I'll put in earbuds.
I don't, because I did all the testing and I chose not to go that path because I think I was doing more harm.
Yeah, exactly. And so, now, a lot of times the phones have a setting on them, and you can actually adjust that setting, turn it on or off, where it's supposed to actually try to protect your ears. And they do that because they don't want you suing the phone company, that made that phone. So it does serve a purpose, but whenever I'm doing that and when I listen to I'll do it with the lawnmower. It's not as loud. Same thing with the tractor. If I'm driving my friend's tractor, we're out cutting hay, I will wear that, and I can hear it okay without being too loud. But when I'm using the weed eater and I have that music going on, or a podcast is usually what I'm doing, so I can learn. I don't want to waste time, so I want to use all those hours of learning while I'm doing that. Then when I turn off the weed eater, it's like, oh man, that's really loud. It's like, and yeah, I just didn't know.
Yeah.
So really, I was not protecting my ears, with that situation. So actually, I don't do that as much anymore. I do wear actually more like an ear muff that is geared for shooting guns, but I turn it off so I won't hear those sounds.
Well, let's talk about that too, because if you're around that instant, like I'm a big shooter, I love to shoot guns, and so I became aware that if you put the headphones on over your mastoid, I mean, if you've ever heard bone conduction earphones, well, you're not listening to that music through your ear canal, you're listening to it by bone induction.
Right.
And so when you're shooting guns, there's bone induction, that sound's getting to your head through the bones. So you wear the big muffs, and then you wear the inner ear canal. I mean, I wear both. And so I'm trying to protect both. I don't have much hearing left, and now all of a sudden I've become very, how do I keep it as long as possible?
Right.
So I'm doing all the things, and people don't if you see people at the gun range wearing both, it's because they heard this conversation at some point.
And that is much more common, and I have seen that too. And so the foam plugs, will decrease decibels by about 19 to 20. And earphones will do it about 19 to 20. So the net effect by doing both of them may be like 25% or 25 decibels, which actually is a good decrease, in how much sound is getting through to the ears.
Well, all this bone, your mastoid, all the way around your ear, for the most part, is very porous, and sound travels right through it. That's why bone induction hearing, any kind of those kinds of hearing apparatuses work so well.
Yeah, that's right.
Because it's going to conduct right through that mastoid, so I protect it.
That's why they're doing the cochlear implant. So, I hear that tapping. I feel it, but I hear that.
Right.
So we can hear that. So yes, that our brain is made, our skull rather, is made for that conduction type thing. So it's interesting, and I know it's easy to go into an area about, other things that can create problems, about hearing loss, about Wi-Fi, and about cell phone coverage. And I'm not going to go into that because there's not enough science for me to say yay or nay, but I think we do need to be cautious about that. So, matter of fact, our skull is actually shaped, it's actually a pretty interesting shape.
It's an antenna.
It is. Matter of fact, did you know that it can actually transmit? And so, you can, I've done this in the parking lot. You can try to, unlock your car, you're too far away, put it up here, and it unlocks it.
Isn't that crazy?
So the brain acts as an antenna and focuses things, but also it's a receiver. So at the same time, so yes, it can focus.
And don't do that all the time. You're putting power into your brain.
That's not. Yeah, I'm glad you pointed that out. So no, I don't do that all the time.
Go experiment once and then
exactly. Yeah, we were doing that one night actually after a football game, and we were a long ways away, and so yes, my son-in-law said, "Hey, watch this," and he was able to start his car.
That's
where he
crazy.
couldn't, for down here. So, on that. So, circulation is the thread to all of these problems, okay, with the inner ear. We have to address that. So, now, along that line, so issues that are related to the hearing issues and issues. Now, there can be other physical things. So, part of this dizziness can be also little crystals that are forming on the little tiny hairs or cilia. There's another term for those, inside that inner ear. And if little crystals are forming, that creates some of this weird dizziness type thing. There is a procedure that many doctors and chiropractors do, and physical therapists, where you tilt your head a certain way, a certain pattern.
The Epley maneuver.
Okay, thank you. And so by doing that, that can help with that cause. So once again, you got to seek somebody to figure that out. But I think you also, people have done that, and it's not helping.
Well, they've done it, and they had really good success for a year or 2 years at a time. Then all of a sudden, that crystal's out of whack again. They're going back thinking it's going to be a quick fix, and it isn't. It's like it's getting worse. So that time interval is changing.
It does make a difference, on that time interval. And so, matter of fact, all of this is important. Timing's important. If you start having these symptoms, hearing loss, dizziness, vertigo, tinnitus, those are signs of vascular disease items, going on. Probably
could be.
So you need to get in and you need to figure that out. Now, along that line, so all of these issues are related to high blood pressure. High blood pressure means that it's a response by your body of part of your, or rather an organ not having good blood supply. It could be your heart, it could be your kidneys, it could be your ear, it could be your pinky toe may have poor circulation. Those cells are starting to die out, or your brain is starting to die out, and those cells are saying, we need more blood supply, and we need your help, heart. And so the heart says, okay, let's pump that harder and increase the pressure to squish the blood through to that organ, okay, those cells. So we have to pay attention to why is there high blood pressure. Now, there can be other reasons. A plaque buildup, atherosclerosis, the kidneys make blood pressure medications, stress. I have a problem with that, and so I do therapeutic breathing. Matter of fact, there's going to be a little weave into that many things, in doing this. But so high blood pressure is one of those things related to this. Diabetes and high blood sugar. Diabetes, elevated blood glucose, damages the inside of the blood vessels. And so, matter of fact, an A1C blood glucose is actually measuring damage to red blood cells. And so, and that happens inside the blood vessels. So, metabolic syndrome, which is a broad term for actually blood sugar, cholesterol, but overall also belly fat. So the more belly fat a person has, often the worse the problem. Although I do know people with ear problems that don't have belly fat problems. I know people that have had heart attacks and don't have belly fat. So it's not. So once again, we got to figure this out. Smoking, obvious. Smoking, no matter what you smoke, breathing in that smoke damages your cells. And matter of fact, each cigarette or item that you smoke, is equal to, you will burn up over 100 milligrams for each cigarette. 100 milligrams of vitamin C. My brain goes faster than my mouth. But 100 milligrams of vitamin C for every cigarette. So vitamin C repairs cells.
So something we talk about in here, because we have so many cancer patients, and so everybody, not my patient, but so many people dealing with cancer, when they come in here, we start talking about all the things that we smell. I have essential oils here. I run them in all the diffusers, and everybody says I feel like I'm at home. When you walk into some place that's burning incense candles, that's not good. People do not understand the chemicals that are in that, in the soot. I mean, you're smelling the soot, literally, the burned chemicals. So those are not good aromatherapies.
Correct.
And then when you walk down the detergent aisle in the supermarket, just think of all those things you do not want to breathe. That's what you're breathing, is all the stuff you should not be breathing.
That's correct.
So you don't use the laundry, the dryer sheets, the sensed laundry detergents. I mean, all those things are to make us, I don't know what would make us feel good.
Just that smell, and it's an instant reward, not long lasting, but an instant reward. So yes, so aromatic oils are like that, are great. The ones burning incense
that you plug into the wall,
or the electric ones,
any of those,
any of the electric ones, but burning incense, that smoke, or plug-ins, release chemicals into the air that we breathe in.
They're microscopic, and
That's right.
they're accumulating in us.
And those are a risk factor for lung cancer.
Yeah.
Okay.
Yeah.
As a matter of fact, most of my clients with lung cancer have never smoked.
Isn't that crazy?
But they're breathing in something that's damaging the lungs. So we do need to be careful about that.
We're getting off a little bit, and I apologize for that.
Smoking is a problem, and or chemicals. High homocysteine level. So homocysteine is a chemical that our body makes, but if you do not have enough methylfolate and methyl B12 and even other methylated B vitamins, if you're low in those, homocysteine elevates, and homocysteine basically kind of like scratches the inside of blood vessels, and then that is an initiator of plaque buildup. So now the cholesterol, and other fats, and a scab starts forming there. Let's call it a scab even, starts forming, and that's increased risk of heart attack and stroke and circulation problems. So homocysteine is important blood test to get for my cancer clients, because it lets us know if they're getting enough of the methylated B vitamins. And then there's also genetics involved in that. So synthetic folic acid is not where we're going. So that is not always the best option.
So if you have this plaque buildup, we were talking in the chamber, and maybe we just haven't got to it yet, but you were talking about K2 and nanokinase being very effective in scrubbing and eliminating some of that. That's a tool.
Right. Yeah, so I do like to use a vitamin K2. Do we have to be a little cautious? Well, because many practitioners are concerned about an interaction where K2 might decrease the effectiveness of anticoagulant therapies. Actually, warfarin is definitely a potential issue. Others don't seem to be as much of an issue. But vitamin K2 attaches to that calcium inside the blood vessels and pulls it out and moves that calcium into the bones. It stimulates bone growth. So I have had one client documented that he had significant plaque buildup, 80% blockage or so in his carotid artery, and within 2 months it was 50% better by doing the K2 at a high dose and nattokinase. So nattokinase is an enzyme that eats away at the plaque. It softens it, and it's one that actually you have to take on an empty stomach. It's kind of a hassle, empty stomach. And then the K2 even helps to attach to the calcium that could be stuck in that and pulls that off. So yes, those are a couple of items that may help, but the problem is that it's not instant. So these are many months and maybe even years. So I do take, due to the tinnitus and some hearing loss that I have, I do take nattokinase every single day as part of my routine. Actually, that's my first thing in the morning. A glass of water and the nattokinase, because it works better empty stomach.
Yeah, and again, you already mentioned that it does not do well with some meds, so that's something you always want to go through your provider and say,
check.
hey, I heard this. We hear a lot of things now since we got all this social media. Yep. So I heard this. Am I on the right track? And get it cleared. Just Keith knows the things that you can and can't do. That's why I
do those checks.
I'm such a fan. So
I do those checks. With my clients yesterday, I was checking their therapy, their drugs that they're taking for cancer. What do their supplements do with those? So yes, that's very important to do that. And then sleep apnea, breathing problems, is known to be a risk factor for heart attacks and strokes anyway, but it's related to hearing loss. And once again, they're all interrelated. Excessive weight and inactivity. So, part of this improved circulation is physical activity. We're going to talk about some other things too. And I don't know if we're going to get to it today or not, what some of these other tactics, but exercise is very important. And or I like to do things like the hyperbaric, normal air to increase blood supply, dilate the blood vessels. We've got to dilate those blood vessels and get nutrients so that the body can have a chance to heal. Okay, by the way, submit your questions. We have about 10 minutes before we're going to do Q&A. So submit your questions. The handout is available at hyperbaric.plus, at the resources page, and at Prevail Over Cancer, the Learning Center. On my page is down toward the bottom. So get your free handout so you can check this out and learn a little bit more. Hearing loss, what causes it? So age-related. So actually, a statistic that 63% of Americans over 70, have some measurable amount of hearing loss, and then, but only about 3.4% actually have to have a hearing aid. But as a matter of fact, I'm looking at that. So if a person does have to have a hearing aid, then I'm thinking, I wonder about their circulation. Okay, what other organs, other parts of the body may be impacted by that. So noise, excessive noise, we talked about that. So cumulative, long-term, continuous sound can be a problem, and or just a quick one incident can create some hearing loss. It's mainly preventable if we slow down and think through that. And matter of fact, the hearing loss starts going on and it accelerates a problem, and it can definitely keep getting worse. Earwax impaction. So matter of fact, I was thinking I had a significant problem. So I went to the ENT, and the ENT, it's really sad when the ENT says, "Oh my," he looked in my ear, earwax. And so, so first thing he says, "Are you wearing in-ear buds?" I said, "Yes, I'm a musician." He says, "Well, that's the problem. You're pushing stuff back in there every time you put those in." And so now I have a routine of washing. And so he gave me a recipe, of water, vinegar, and hydrogen peroxide to wash out my ears. And so that I don't have to go in. I still actually go in, and I still have to sometimes have a professional do that to clean that out. So earwax is going to block some of that sound that can go in. So that's where one ear might even be worse than the other. Although, and some people make more earwax than others. But washing that out. Medications. There are certain medications, including some antibiotics that aren't common but sometimes have to be used, called aminoglycosides, and then platinum-based chemotherapies can cause some permanent. The little hairs, we're talking about those, the crystals that were on the hair. So there's these crystals sitting here, and now these don't work as right, so that creates a kind of a dizziness, motion type issue. But if those little hairs aren't there anymore, they're like that, now you're not going to hear, okay? And literally, these antibiotics and some chemotherapy drugs can damage those. Once they're damaged...
Well, if your hair falls out here...
Okay, I'm glad you mentioned that.
You're probably damaging the hairs in your ear canal.
So this is I didn't know this till actually a few years ago, probably about 5 years ago. There's what's called calyx inside the blood vessels. Even our blood vessels have hair. Okay, and so that hair helps move stuff through the blood vessels. It's part of the circulation. When the heart beats, that hair helps push stuff through the blood vessels. If that hair is dying out, now things don't work as good. And so yes, there's these hairs that are inside the ears, and if they're this big, they're not going to work as good as like that. So so it's very important to get, to improve that hair function. And that is actually one of those risk factors, is actually hair loss caused by circulation is a risk factor. And so men that have a problem with, genetically, men have a tendency to have more problems with this, but dihydrotestosterone has a tendency to make hair follicles go to sleep. So it's not always circulation problems, but that's also one of those things I'm looking at with my clients, if there's some hair loss. So there are things we can do for hair. And so
red light there.
Yeah, so I do red light on my knees most nights. I have some damage to my knees, my knee caps more specifically, and so I'm doing red light therapy. And the hair on my kneecaps is amazing how much it's growing. and I'm turning more of my hair is getting lighter in color, and this is actually kind of dark. So it's kind of like it's 20 years, 40 years younger, And so red light does have some impact on hairs. But the challenge is getting it deep enough.
Right.
So a lot of generic low-cost type red lights aren't going to work. And so, matter of fact, a client yesterday, she, her and her husband, they're healthcare practitioners, and they have a sauna with a red light in it. They want to know if that red light was good enough, or that would that help or hinder their treatment program. I said, well, that red light up there in that sauna is not therapeutic. It's not going to have any impact. It may have a little bit of a visual impact, yes, but it's not going to impact your treatment. And so, but you have to have a certain wavelength on the red light therapy, more like 800 nanometers or higher, 800, 1100, to penetrate bone. And so, I know you have some things here that you do with that. So,
don't start down the red light deal, because I'll wear you out.
Well, I'm getting ready to say.
On target.
I'm getting ready to say. So, my wife bought a red light in ear type thing. I don't think it's working. Well, she's trying it. I don't think it's working. So our next step is
for her tinnitus.
Yeah, for tinnitus. And matter of fact,
tinnitus.
Her tinnitus is actually different than mine. Mine's a high pitched sound. Hers is a low pitched sound, and so hers is probably due to hearing loss. So her family definitely has a challenge with a family history of that, and so all the doctors are saying was it's a compensatory reaction, your body trying to make up for the hearing loss, and that sound, that static is occurring. So anyway, so she's trying it and I'm trying it. I can't say that seems to be helping. I just don't think it's the right type, and still, even though it's inside the ear, it's not strong enough to penetrate. It's not the correct wavelength.
So to kind of recap or kind of stay on target here, we're trying to be talking about vertigo, which is driven by symptoms. There's not a vertigo germ.
Correct.
But we have to be able to recognize the symptoms that we call vertigo. And we're talking right now just about ear health.
Yeah, I mean, general. General. Okay, yes.
All leading to if this stuff starts failing, that's when vertigo can show up.
Exactly. So it's a progression type thing. We have the hearing loss. We may have tinnitus. Not everybody does, but it's a progression that has a tendency to keep going till it gets worse. And so, and I personally, even though it seems like you've noticed that it's been more of a recent problem, you've noticed a lot more people recently. For me, I've seen it always, because I've always dealt with some more senior type people, so it's a common type thing. So, but no matter what the hearing, whatever the ear problem is, we've got to improve circulation, and help those hairs to work properly. Okay, so medications can create problems. Even regular non-steroidal anti-inflammatory drugs can create hearing loss,
like ibuprofen,
naproxen, things like that. Exactly. So
I hear that quite often.
And even acetaminophen. Long-term use. Actually, using it more than 2 days per week increases the risk of hearing loss. I know that's amazing on that. And then conduction causes, and so fluid, perforations, damage to the eardrum. Of course, plaque buildup. So if you have problems with just one ear, all of a sudden, that is a medical emergency. So I want to stress that. You want to get in, got to figure out what happened. There might be something that could be done in an emergency situation.
Hyperbaric oxygen is cleared is one of the reasons that you can get in a hyperbaric oxygen chamber is sudden hearing loss. And I have people come in a year later and go, a year ago, all of a sudden I couldn't hear anymore. Well, I'm back to circulation. What was happening in that part of the year that damaged their hearing?
Right.
That has been studied. It's FDA cleared. It's insurance reimbursable. Sudden hearing loss you get in a chamber. And people don't, that's not broadcast. They don't know.
That's right.
So if you have sudden hearing loss, now if you go out a month,
that's right.
At some point, that's not sudden hearing loss anymore. So if you have sudden hearing loss, go to your practitioner and say, hey, I understand hyperbaric oxygen is cleared for recuperating from this, and at least ask the question. People don't know that Don't wait a year. That's not sudden.
If it's been more than 2 months, it might not help.
No.
Okay.
I mean, you're done.
That's right.
So,
yeah. And so, we now that we had the damage, and depends on what that damage is, but you think of it, it's kind of like 2 months after surgery, I mean, the damage has been done, your body's scarred, and that wound is closed and there's scar, and now there may be limited function to a certain extent of that area. Same thing with the ear, with an injury, with that. So, so what to do? What should we be doing? So, get a baseline test to find out about hearing loss. Repeat that every 1 to 3 years, depending on how serious the problem is. And be careful about certain antibiotics, or even some older diuretics that people take for blood pressure. Oh, they got blood pressure? Now, they're at a higher risk of ear problems anyway, but certain types of medications increase that risk. You can have wax checked, and they can, they have tools, and they use a little scope with a light so they can see what's going on and pull some of that out. And it's amazing how much they can make a big difference. If you have hearing aids, wear them. And so that helps your brain. You hear things better, you process things better, your brain's going to be better. So wear the hearing aid. And then also make sure that they're programmed right. And a less expensive one is going to amplify sound, but it may not be the right ranges that you need. Protect what you have. Wear the earplugs and muffs. Most of them are like 20 decibels. Got Q&A.
Thank you.
Ryan, hi. Okay. So, okay. And then, you got to be sure. Matter of fact, I keep those phone plugs in everything. I've got them in my truck. I've got them at home. I've got them in my gun safe. I've
got people that dive with me that like quiet. They don't want to get in here and have a conversation. Okay. And so we have earplugs here as well. Yeah. But they don't cancel out everything.
No, they don't.
Exactly. They will deaden it if that can get. They try to get in there and read a book, and we try to keep the noise down. But most of my clientele, to be honest, get in here for the camaraderie.
Yeah,
they all want to talk about what they're dealing with and
learn and things like that.
We learn a lot in there.
That's right. So, but anyway, so protect it. I try to have those with me because I never know what I'm going to be doing. Matter of fact, it's kind of like I have my spurs in my truck. Okay, I have my tools. I have all kinds of stuff. I've got electrician's tape in my truck. I've got everything in there. That's my second home, basically. And who knows what I'm going to be doing. So I try to have that with me at all times because I've been caught without it. So, okay, we're going to do Q&A, and we actually are on step 4 out of, 8 or 9, okay? So, yes, we're going to go into next week some more. So we're going to be talking about tinnitus, why your brain is making sound, what helps and what doesn't help with that, dizziness and vertigo. That's what you originally contacted me about things that help with that. And then we're going to be going into more like treatments and nutrients that can help out with that. I'm sure people are going to share. Once again, submit your questions. If we don't get to them today, we'll get to them next week. But
the first question is, where do I find the sheet that you're holding?
Oh, yes.
We didn't talk about that. So.
It's available at Hyperbaric.plus resources page, and at Prevail Over Cancer, the Learning Center. And so it's a downloadable guide. Click on the link, and it opens the document up, and you can download it and print it. And so, so that was the first question. So we got a lot more that we can cover. So we will be going over that next week. And so, by the way, we need to be careful about supplements and trying to do this on your own. I do have a free workshop on my website. At the top, there's a blue banner. Click on that. It's called the 5 Supplement Mistakes for a person with cancer. That's frequent mistakes people make. It's a free webinar. It's about an hour long. So check that out. And there's some free downloads and free information. So we don't want you making mistakes. So seek some help. And that's one way to do that by going to that particular program. So, okay, Q&A. So answer number 1 about where to get that sheet. Suddenly get ringing in one ear, feel dizzy. How do I know whether it's something minor or a stroke warning sign? See a practitioner. Do not wait. Matter of fact, I have to admit, if somebody contacted me like that, I just say, go to the emergency room or minor emergency clinic, whatever. You need to have somebody evaluate that. They need to be taking your blood pressure, and they need to be listening to your carotid arteries. That an experienced practitioner, they can hear that sound and can tell you if there's plaque buildup inside your blood vessel here. But you got to get some evaluations done. Do not wait. One side actually is a little bit more concerning to me, that there may be a major blood vessel issue, maybe on one part of the body or the face or the head, brain, okay? So get in and see the doctor with that. Okay, what's the difference between regular tinnitus and pulsative tinnitus or tinnitus? And so I'm glad you mentioned that. So we'll actually go into that some next week, but so there's tinnitus, which is like, for me, it's a continuous ringing. It's hard to explain, but in music, I'd say the pitch is probably like about a G above the staff, which means pretty high. Well, at least a G, maybe a B, above the staff, a pretty high pitched sound. And it's in both ears, maybe a little worse in the left than what it is in the right. So, and then there's also some that pulse, and it's like every heartbeat, you hear that heartbeat in your ear. That's a concern. And so that actually is one of those signs that the blood is squishing through a blood vessel, and I would venture to say you may be at a higher risk of a stroke. And a stroke can happen actually anywhere. Some people have a brain attack, a stroke. Some people have a heart attack. Some people have a kidney attack, chronic kidney disease or sudden kidney disease. I've known people actually just all of a sudden, actually, their kidney atrophied and disappeared because the blood supply was bad. They had a kidney attack and didn't even know it.
Wow.
And so, and then, or your pinky toe, okay, you get neuropathy. So those are all circulation problems. So be sure and seek some assistance on that, but especially the pulsative. And if a doctor doesn't know why, doesn't mean you need to ignore it, okay? Seek more help.
Well, look at it online, find those, I want to go to the doctor and be able to ask really valid questions.
Right.
And the more I educate myself, the more I can go in and say, look, I need to know the answer to this. And if they don't have an answer, you need to seek out some more
seek out somebody else.
Yep.
Seek somebody else. And say, okay, who else do I need to go see, whatever. Or this, you need to be a squeaky wheel. You need to be getting that attention, so something's not right. So another person says, sometimes I lose my balance while walking. Same time my ears are ringing. Is that related? Could be. Yeah, definitely. So
jot those notes down so that when you get to talk to somebody, you don't leave that out.
Good idea. Write it down.
Yeah.
And have that note ready to go so you can present that information to the clinician. The more facts that clinician has, the better that they can help. Losing your balance while walking is not a good thing either. Okay, there's something significant going on. So I don't know, what it is, and it could be separate. It might be related. You got to seek help to figure out that what's going on. So I know, my mother had problems after she had surgery once, and I say this, I don't mean to scare people, but she had surgery. We were walking out of the hospital after that surgery.
They let you walk out?
And we got to the, well, actually she did. What was the deal with that? She was walking through the parking lot at the hospital. So we got out. I don't know why. Anyway, yes, she was walking, and she almost fell. Went back in. She had a brain tumor.
Wow, you're kidding me.
And so, and that's actually one of those signs, is like all of a sudden losing the ability and control of one part of your body. We didn't know at first if it was a stroke or what it was. I mean, they got her in instantly, did a MRI, CT scan, and she had a brain tumor. So that, and she didn't really, it was a very quick, type thing that happened. So with that, and I don't mean to scare you, but losing balance while walking, something's not right. And so it may be a back problem, maybe a nerve problem, I don't know. But you got to seek help.
Don't ignore it.
Don't ignore it. Any concerns with EMFs regarding red lights? I don't know of any concerns with that.
So if you buy a quality red light,
Okay.
they will give you an EMF. They measure
Score,
that, and
okay.
they'll tell you what their spec is. But you're right. There's some of the less expensive red lights have a lot of EMF, and you're kind of counterproductive. So there's going to be a couple of things that are real important. You were talking a minute ago about if there's something over your head. Think about a red light that has the elements, the lenses. Well, think of a football field. When you're at a football game, those lights are shining at a spot on the floor of the stadium.
A certain distance.
People don't know that. They think there's just light up there and it lights the place up.
Right.
But those lights are individually focused on a part of the field. That's how they work in stadiums. And think of the same thing being on that red light.
Right.
The radiance of that light coming out of there, they measure it on the
distance.
one I use, they measure it at 8 inches.
Okay.
And you have X amount of joules,
Which is energy.
per centimeter square. So that's how much at 8 inches is landing on your body, and that's 8 to 12 inches. And our panel is the one that's where you want to stand. The further you stand away from 12 inches, the less percentage-wise that you're getting benefit.
Right.
So it's real important to understand that. I see a lot of pictures of people with red light panels, and it's 3 feet away,
Yeah, I know.
and they're
doing
reading
the whole
a book.
body. They're doing and they're reading a book without eye protection,
And they're not getting hardly any
Right.
therapy. So it's real important to understand what that panel is rated at. And EMF, the cheaper the panel you get, you're going to probably have a little more EMF.
So the company should be able to provide that information. If they can't provide that information, we don't know. Okay. So so ask them for that certification, and often it's by an independent lab that does that test. It's not the company itself, but they have another independent company that tests that. Third party assessment on that. So does the chamber help with tinnitus, or does it make it worse? So I'm going to put my input on this. I typically do this once a week, and I haven't seen any change. I have not.
Yeah.
Okay. And I don't think that's often enough.
No,
okay?
I would never tell somebody to do hyperbarics and address tinnitus.
Okay.
Now, do I have people that get in and they notice a difference? Yes. But I would never tell somebody to expect that.
Okay.
But
the purpose of the chamber is to improve circulation. So I would wonder if it would. That's a great question. I don't know. I would
if it
wonder.
was sudden hearing loss, then I would do this just to see if I had any change in that sudden hearing loss. But I would also be talking to my provider.
Exactly.
What's crazy is it's good for sudden hearing loss, but it takes you a month to get approved to get into the chamber.
Yeah.
I mean, that's what you're going to run into going to a provider, going to your insurance. Your
Right.
insurance approves it. There's not going to be anything sudden about it.
Right.
So now even with diabetic foot wound, I have a lot of people, they come in here and tell me why they're here, and I go, well, you need to start the process of getting into a hyperbaric chamber that your insurance will pay for. But do this
in the meantime
until then, because you're in for a wait. And if it gets approved,
right.
A lot of times it just doesn't get approved.
Yeah.
And a lot of times the copay is more expensive than doing this with me.
These sessions, that's right.
Anyway, a lot of things to take into consideration.
Okay, so does it make it worse? I wouldn't think it'd make it worse.
I've not
seen any reports of that at all. So, what can I realistically do at home to support ear health and reduce my risk of hearing loss or falls? And so it's vascular. So everything that we talk about, that we have talked about, but we've got to you need to exercise to improve your circulation, improve your muscle coordination and control, and we have to be intentional in that exercise and use your own body for weight, if not resistance or bands or other tools. But we've got to build up our muscle, to help decrease that risk of falls and, But that exercise also helps dilate the blood vessels, like the chamber, but dilate those blood vessels, which means open up the blood vessels, improve circulation to allow things to get better.
I watched an awesome video this morning, and it was a doctor talking about metabolic dysfunction and nutrition, and all she did was start eating whole food. She's a doctor. She's never been taught nutrition.
Right.
And I mean, it's a 15-minute video, and I was blown away by how much information she gave and how people, if they follow her simple rules, they can fix metabolic dysfunction. And if our body's operating at a higher level, everything else is going to operate at a higher level.
That's right, yeah.
And so anyway.
Yeah, so along that line, real quick as a closing, because we got about 2 minutes, is that the Mediterranean diet, and then also the DASH diet, which is a low salt sodium diet, but the Mediterranean diet, once again, for this health issue, like almost all other health issues, appears to be one of the better ones. So those polyphenols from the vegetables and the fruits and the nuts, and other foods. I'm sure I'm missing a lot of things, but in vegetables, the polyphenols help repair our body. And so, but the Mediterranean diet also shows the best benefit. Just if you want, what's the best diet? Yeah, Mediterranean.
I'm going to be posting this video in our newsletter, and it'll end up on our resource page. But she leads with every meal. She leads with protein. She eats her protein first, and people just don't understand how important that is.
Timing, right?
Protein signaling everything of how to do this, how to digest that food.
Right.
And by starting off with protein, and that does not mean any kind of ultra-processed food. I mean, you just got to get away from that kind of food. That's
Packaged
number
foods.
one.
Packaged foods are no-no. So, matter of fact, my plate, when I eat, I always turn that plate so the protein is right here.
Yep.
That's the first thing, and then the vegetables, okay?
Yep.
But I'm eating that first. And so concentrating on the protein first. That actually slows down the absorption of carbs.
Yep.
So on that.
Well, Keith, everybody's ready to jump in the chamber.
looks
We're
like
at the
it.
top of the hour. Thank you for being here again. Keith with PrevailOverCancer.com. Wealth of information. Visit the website. Come and visit us. We're at 122nd in May. Look for the big Hyperbaric Plus sign, and love to have you. But Ryan, thank you again for everything
Yes,
you do.
sir. Thank you.
We are good to go. We will see you all next week for part 2. Thank you. Thank all of you all for your